Oh, oh, baby, 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 oh, like, baby, 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 no, like, baby, baby, baby.
After your doctor has determined you're pregnant, your initial prenatal screening will consist of blood testing, depression testing, alcohol use, STIs, immunity history, urine testing, which are tests that all women receive. Your doctor may determine that you need tuberculosis testing, cytomegalovirus testing, a pap test, thyroid stimulating hormone levels, drug abuse screening, and if you have any questions about what the tests were or what the results mean, ask your doctor or visit the American Pregnancy Association for some answers. Visit schedules are as followed for prenatal visits for uncomplicated normal pregnancies. The first 0 to 28 week visits are every 4 weeks. During the next 28 to 36 weeks, visits move to being every 2 weeks. And finally, from week 37 to delivery, the visits are weekly. While the fetus is growing, it affects more than just the abdomen. Some other changes that may present themselves are as follows: body aches, breast changes, constipation, dizziness, fatigue or sleep problems, heartburn and indigestion, hemorrhoids, itching, leg cramps, morning sickness, nasal problems, numb or tingling hands, stretch marks or other skin changes, swelling, urinary frequency and leaking, and varicose veins. During pregnancy, weight gain is variable among mothers. For uncomplicated pregnancies in women with BMIs within normal ranges, weight gain should be between 25 and 30 pounds. The weight gain should range over the 3 trimesters, with 2 to 4 pounds during the first trimester and 3 to 4 pounds during both the second and third trimesters. If you gain more than the recommended amount of weight during your pregnancy, you're at a higher risk for being overweight within the next 10 years if you don't lose it within 6 months, and the child is at risk for being overweight. During pregnancy, your body undergoes many changes that can be concerning. The following are some signs that you need to call your doctor: bleeding, fever, pain, chills, headache, fainting, dizziness, frequent and painful urination, moderate to severe bouts of pelvic pain, vomiting, sudden swelling of the hands, or lack of fetal movement. Call your doctor within a day if you have a moderate, persistent headache or vaginal spotting or bleeding that lasts more than a day. Report the following signs at your next visit: slight spotting that goes away within a day, occasional twinges or pulling sensations in your abdomen, or occasional mild headaches. If you have any questions or concerns, you can visit www.womenshealth.gov/pregnancy, and if you think something isn't right, you can call your doctor or go to your local emergency room. How do you know when you're in labor? Some of these may be signs you'll experience during the onset of your labor: lightning, which is an increased pressure on your bladder; a bloody show, which is a clear or pink tinged substance you may find in your underwear; Nesting, which is a sudden burst of energy that will motivate you to do things you've put off doing. Effacement, which is thinning of the cervix. Dilation, which is the opening of the cervix. And a rupture of membranes, which is a gush of amniotic fluid indicating the onset of labor. Contractions are the one sure sign that labor is really happening, and once your contractions are 5 minutes apart, call your doctor. To be sure it is labor and not false labor, indicated by Braxton Hicks contractions, wait until they're 5 minutes apart. It's important to create a birth and care plan before the onset of labor so that you, your partner, and the healthcare team know what your expectations are and can treat you with exceptional care. During the actual labor process, the care plan may be altered, so it's important to be flexible and make the most out of your birthing experience. To create a birth and care plan, the first thing to do is to be educated on what's important and the components of birth and labor. Components of the birth and care plan are choosing a birth setting, asking questions.
Who do you want to be present at your birth?
I don't know, that's something to think about.
What activities or positions do you plan to use?
I think I might want to walk around.
What will you do for pain relief?
I don't really know.
Planning for the unexpected, asking what will happen if an emergency C-section is required. Know that during the birthing process, if you are unsure about a procedure, ask if it's an emergency. Design your birth plan with a focus on the positive by making a list of things you want to do instead of things you don't. Include your plans for pain relief, fetal monitoring, and the best ways to support you. Plans for the actual birth.
What are your positions for pushing?
I don't know. I'll have to think about that.
Are you going to have an episiotomy?
Ooh, I'm not sure.
What are you doing with the placenta?
I don't know what to do with the placenta.
And postpartum plans.
How will you feed your baby?
What kind
Probably
of test?
breastfeed.
Yeah.
What kind of testing do you guys want?
I know I don't want an amniocentesis.
What kind of testing do you want?
I don't know. Will your baby stay with you in the room?
Probably.
Yeah, I think so.
Determining what you intend to do while not at home. And baby care plans, including how you will feed your baby and where your baby will stay. You will also include in your plan contingency plans regarding a C-section.
Who do you want to be with you?
Probably my husband.
Yeah.
What type of anesthesia do you want?
I don't know. I don't want to feel anything though.
What do you want? Do you want to breastfeed?
I think so.
These components are meant to guide you, determining a rough idea of how you want your labor to go. Remember to be flexible and remember the overall goal of bringing another life into the world. You should now have a rough idea of prenatal screening, the visit schedule, body changes, weight gain, when to call your doctor, signs of labor, and knowledge about a birthing care plan. If you have any further questions, contact your primary care provider.
Rupture of membranes.
What you gonna do with all that junk inside your trunk?
I'ma get you drunk, get you love drunk.